Hi, I'm Dr. Kevin Casey with another episode of Cooking with Casey. My guest today is Dr. Michael Quartuccio. Michael, welcome.
Thank you.
Michael is an endocrinologist at Rochester Regional Healthcare System at our Alex Park location. Today we're going to be talking about diabetes, but before we do that, let me tell you what we're cooking.
Sounds great.
We're making a steak, apple, and shrimp salad. Some great proteins, a little bit of carbohydrates. It should be a great lunch. So, Michael, tell me a little bit about diabetes. What exactly is diabetes?
There's two general types of diabetes. There's type 1 diabetes and type 2 diabetes. Type 1 diabetes is less common. Only about 5% of people have it. And those are folks that no longer make insulin, so they're not able to get any glucose into their cells. Type 2 diabetes happens much more commonly. It used to be called adult onset diabetes. It's when you're still making insulin, but the cells don't respond to it the same way. So in type 1 diabetes, it's generally considered an autoimmune disease for most people. Type 2 diabetes is a little bit different. Family history definitely comes into it. So if you have other family members that have type 2 diabetes or polycystic ovarian syndrome, you're definitely at higher risk. Leading a sedentary lifestyle puts you at higher risk of type 2 diabetes, being overweight or obese, and then there are certain ethnic predispositions as well, where people of African descent and Hispanic descent are at higher risk for diabetes.
What are the symptoms people get when they're developing diabetes? What things should our viewers be thinking about?
Absolutely. So with either type of diabetes, symptoms could include having excessive thirst, excessive urination, and a lot of times that'll present as nighttime urination when you didn't urinate in the night in the past, and weight loss can actually happen as well. But honestly, the scariest symptom is the lack of symptoms, especially for type 2 diabetes. Many people don't have any symptoms at all, and this can be, pretty insidious, as they would call it. It can really come on quite slowly, and it can be there for years before any symptoms happen.
What do you tell the patient who comes into you for a new consult, new onset diabetes? What do you say to them?
So with a new diagnosis of diabetes, it requires a lot of lifestyle adjustments. You go from not having to test your blood sugar to testing maybe several times a day. There are new medications. There are new lifestyle choices that have to be made. Changes in diet, changes in exercise. I'm really thinking about a lot of things that you didn't have to think about before. And just like with anything new in life, it's going to require an adjustment, and it's going to be a little uncomfortable in the beginning. But this should not be something that's devastating. It should not be something that people lose hope over. You can live a very healthy life with diabetes, but it does require some changes. So I just like to have people take a deep breath in and realize that there's going to be small changes that happen over time, and eventually their life is going to go on as normal.
Michael, thank you very much for coming. I'd make the point, if you have any symptoms or concerns about your health, make sure to see your primary care physician who can answer those concerns. Thank you very much for watching this episode of Cooking with Casey, and we look forward to seeing you with another episode in the future.